Low pulse, hypotension. Low blood pressure may appear to be attractive, and for certain individuals, it causes no issues. Notwithstanding, for some individuals, strangely low circulatory strain, hypotension, can cause dazedness and swooning. In extreme cases, low pulse can be dangerous. A pulse perusing lower than 90 mm of mercury, mHg, for the top number, systolic, or 60 mm Hg for the base number, diastolic, is by and large viewed as low circulatory strain. The reasons for low circulatory strain can go from parchedness to genuine clinical issues. It's essential to discover what's causing your low pulse with the goal that it very well may be dealt with. Side effects. For certain individuals, low pulse flags a basic issue, particularly when it drops abruptly or is joined by signs and manifestations, for example, dazedness or tipsiness, swooning, obscured or blurring vision, sickness, weariness, absence of focus, stun. Outrageous hypotension can bring about this perilous condition. Signs and indications include disarray, particularly in more established individuals, cool, moist, fair skin, fast, shallow relaxing, frail and quick heartbeat. When to see a specialist. Given that you have signs or side effects of stun, look for crisis clinical assistance. Contingent upon that you have reliably low pulse readings yet feel fine, your primary care physician will probably screen you during routine tests. Indeed, even periodic unsteadiness or dazedness might be a generally minor issue, the aftereffect of gentle parchedness from an excessive time in the sun or a blistering tub, for instance. All things considered, it's imperative to see your primary care physician on the off chance that you have signs or indications of low pulse, since they can highlight more difficult issues. It tends to be useful to track your indications, when they happen and what you're doing at that point. Causes. Circulatory strain is an estimation of the pressing factor in your supply routes during the dynamic and resting periods of every heartbeat. Systolic pressing factor. The top number in a pulse perusing is the measure of pressing factor your heart produces when siphoning blood through your corridors to the remainder of your body. Diastolic pressing factor. The base number in a circulatory strain perusing alludes to the measure of pressing factor in your courses when your heart is very still between thumps. Current rules recognize typical circulatory strain as lower than 120/80ths of a millimeter Hg. Pulse fluctuates for the duration of the day, contingent upon body position, breathing musicality, feeling of anxiety, state of being, drugs you take, what you eat and drink, season of day. Circulatory strain is generally most reduced around evening time and rises pointedly on waking. Circulatory strain. How low would you be able to go? What's viewed as low circulatory strain for you might be typical for another person. Most specialists consider circulatory strain excessively low given that it causes manifestations. A few specialists characterize low pulse as readings lower than 90 mm Hg systolic or 60 mm Hg diastolic. In the event that either number is beneath that, your pressing factor is lower than typical. An unexpected fall in pulse can be perilous. A difference in only 20 mm Hg, a drop from 110 systolic to 90 mm Hg systolic, for instance, can cause unsteadiness and swooning when the cerebrum neglects to get sufficient blood. What's more, huge drops, for example, those brought about by uncontrolled dying, serious contaminations or unfavorably susceptible responses, can be dangerous. Conditions that can cause low pulse. Ailments that can cause low pulse include pregnancy. Since the circulatory framework grows quickly during pregnancy, pulse is probably going to drop. This is typical, and circulatory strain generally gets back to your pre-pregnancy level after you've conceived an offspring. Heart issues. Some heart conditions that can prompt low circulatory strain incorporate incredibly low pulse, bradycardia, heart valve issues, coronary episode and cardiovascular breakdown. Endocrine issues. Parathyroid illness, adrenal deficiency, Addison's sickness, low glucose, hypoglycemia, and, now and again, diabetes can trigger low pulse. Lack of hydration. At the point when your body loses more water than it takes in, it can cause shortcoming, discombobulation and exhaustion. Fever, regurgitating, serious the runs, abuse of diuretics and exhausting activity can prompt drying out. Blood misfortune. Losing a great deal of blood, for example, from a significant physical issue or interior dying, decreases the measure of blood in your body, prompting an extreme drop in circulatory strain. Extreme contamination, septicemia. At the point when a disease in the body enters the circulation system, it can prompt a hazardous drop in circulatory strain called septic stun. Extreme hypersensitive response, hypersensitivity. Normal triggers of this extreme and possibly dangerous response incorporate food sources, certain drugs, bug toxins and latex. Hypersensitivity can mess breathing up, hives, tingling, a swollen throat and a risky drop in circulatory strain. Absence of supplements in your eating routine. An absence of the nutrient B12, folate and iron can hold your body back from creating sufficient red platelets. Frailty, causing low pulse. Meds that can cause low circulatory strain. A few meds can cause low pulse, including water pills, diuretics, like furosemide, Lasix, and hydrochlorothiazide, microzide, others. Alpha blockers, like prazosin, Minipress. Beta blockers, like atenolol, Tenormin, and propranolol, Inderal, Inopran XL, others. Medications for Parkinson's sickness, for example, pramipexole, Murapex, or those containing levodopa. Particular kinds of antidepressants, tricyclic antidepressants, including doxepin, Silenor, and imipramine, Tofranol. Medications for erectile brokenness, including sildenafil, Revatio, Viagra, or tadalafil, Adcirca, Aleek, Cialis. Especially when taken with the heart prescription dynamite, nitrostat, others. Sorts of low circulatory strain. Specialists frequently separate low circulatory strain, hypotension, into classes, contingent upon the causes and different elements. A few sorts of low pulse include low pulse on standing up, orthostatic or postural, hypotension. This is an unexpected drop in circulatory strain when you stand up from a sitting position or subsequent to resting. Gravity makes blood pool in your legs when you stand. Usually, your body remunerates by expanding your pulse and contracting veins, accordingly guaranteeing that enough blood gets back to your cerebrum. Yet, in individuals with orthostatic hypotension, this remunerating instrument comes up short and circulatory strain falls, prompting unsteadiness, dizziness, obscured vision and in any event, blacking out. Orthostatic hypotension can happen for different reasons, including lack of hydration, delayed bed rest, pregnancy, diabetes, heart issues, consumes, unnecessary warmth, enormous varicose veins and certain neurological issues. Various prescriptions additionally can cause orthostatic hypotension, especially sedates used to treat hypertension, diuretics, beta blockers, calcium channel blockers and angiotensin changing over compound, ACE, inhibitors, just as antidepressants and medications used to treat Parkinson's infection and erectile brokenness. Orthostatic hypotension is particularly basic in more established grown-ups, however it likewise influences youthful, in any case solid individuals who stand up out of nowhere in the wake of sitting with their legs crossed for significant stretches or in the wake of crouching for a period. Low circulatory strain subsequent to eating, postprandial hypotension. This drop in pulse happens 1 to 2 hours subsequent to eating and influences for the most part more established grown-ups. Blood streams to your stomach-related parcel after you eat. Usually, your body expands your pulse and contracts certain veins to help keep up ordinary circulatory strain. In any case, in certain individuals these components fizzle, prompting discombobulation, faintness and falls. Postprandial hypotension is bound to influence individuals with hypertension or autonomic sensory system issues like Parkinson's infection. Eating little, low-sugar dinners, drinking more water, and staying away from liquor may help diminish side effects. Low pulse from flawed mind signals, neurally interceded hypotension. This problem, which causes a pulse drop in the wake of representing significant stretches, for the most part influences youthful grown-ups and kids. It appears to happen on account of a miscommunication between the heart and the cerebrum. Low circulatory strain because of sensory system harm, different framework decay with orthostatic hypotension. Additionally called Shy-Drager condition, this uncommon problem has numerous Parkinson's sickness-like manifestations. It makes reformist harm the autonomic sensory system, which controls compulsory capacities, for example, pulse, breathing and assimilation. It's related with having hypertension while resting. Risk factors. Low circulatory strain, hypotension, can happen in anybody, however particular sorts of low pulse are more normal relying upon your age or different components. Age. Drops in pulse on standing or subsequent to eating happen basically in grown-ups more seasoned than 65. Neurally intervened hypotension essentially influences kids and more youthful grown-ups. Drugs. Individuals who take certain prescriptions, for instance, hypertension drugs like alpha blockers, have a more serious danger of low pulse. Certain infections. Parkinson's infection, diabetes and some heart conditions put you at a more serious danger of growing low pulse. Complications. Indeed, even moderate types of blood pressure can cause unsteadiness, shortcoming, swooning and a danger of injury from falls. Furthermore, seriously low circulatory strain can deny your group of sufficient oxygen to complete its capacities, prompting harm to your heart and cerebrum.